The next form that every surgery patient gets is this one. It is our post-treatment care plan. So this form tells you when we need to see you after surgery. When you're in the office, we'll kind of give you the pre-op, date, and it tells. So our pre-op appointments are 2 weeks before. So if you're having surgery with us, this should be about your 2-week mark. And the prescriptions, it says you'll receive your prescriptions, but actually this form is a little bit outdated. Sorry. So the prescriptions that we used to give them to you at pre-op so that you could go have them filled, but now we actually are able to send your narcotic prescriptions electronically, which is great. So we send them actually when you come in for surgery. When you show up and walk in that door and get checked in, then they send your prescriptions. You'll receive a post-op care kit. That can be, it varies depending on what your surgery is. But it's just a little something that we give you when you come in. If you do your pre-op by phone or by video, then you missed that. So that's one of the benefits of coming to the office. Your final payments are due actually 30 days before, but we check. That's where we're looking for all of our signatures and things like that. If you have somebody else that paid for your surgery and they hadn't been in yet, we would be looking for them to come in, bring their ID, sign their credit card slip before you have surgery. If somebody else paid for your surgery and they don't authorize it before your surgery, then their payment is not valid. It won't be applied to your surgery until after they authorize it. So it'll just be sitting there in, money space somewhere, waiting to be applied to you until we have permission to do so. Then afterwards, we see you around, it says 1 week, or your follow-up number 1. It's like 1 to 2 weeks. It depends on what you had done. So this tells us what you're doing. We wanted to see your incisions. Even though they will probably still have steri strips on them at that time, we want to look for your drain tubes. We're looking at, what color's coming out of there. We're looking at your skin around your incisions. Is there redness? Is the drainage to be expected? For augmentation patients or patients with implants, he will show you the technique for doing the pocket massage. We don't want you to do any pocket massage until Dr. Kratschmer shows you how to do that, and we do that at your first appointment. We will be checking your compression garments. We will be looking at your abdominal binder to make sure that you don't have your tummy tuck one on too tight. That's a big one. And if you're doing a tummy tuck, we're going to talk about that later. So your 1 month appointment, after that, we see you at around a month. And your incision, your steri strips are gone by then. Your incisions should be, for the most part, most patients, they're pretty much almost healed at 1 month. If you have wound breakdown, that's what we're looking for at about a month. And then, again, we're checking garment fitting, things like that. The next one we see is 3 to 4 months after your surgery. Again, so 3 to 4 months is because if you have implants, they have almost settled, about 6 months, but they've almost settled. We can see if one's higher than the other, if we need to intervene some kind of way. For liposuction, that's about the point that your swelling has gone down. We can see a lot more. It's our last chance to be able to intervene with garments if we need to, or lipofoam. So there's a lot of reasons that we have it on this schedule. Your last appointment, we leave blank. You are going to call for this appointment. We'll book out your week 1, your 1 month, and your 3 month, but that last one, you need to schedule, because when you come to this one, he'll say, okay, I need to see you in 6 months, or I need to see you at 9 months. If Dr. Kratschmer says, okay, we'll see you in 6 months, it's not we'll see you in 6 months, we'll see you at your 6 month. So let me clarify that. We want to see you at the 6 month after your surgery, or at the 9 month mark. The reason that 9-month is significant, especially if a patient comes in and they're like, oh, I don't like the way this incision looks, and he's like, well, let's wait till the 9-month mark. We're not putting you off for that long. What it is your incisions, your skin takes that long to be considered a scar. Up until the 9-month mark, your skin's not healed, it's still an incision. So if we go in and we mess with an incision that's in the healing process, we could actually make it worse. So we want to wait until 9 months, until it's actually a scar, and then it's actually a scar revision that we're doing at the 9-month mark. So sometimes people get to the 9-month mark and it's no longer an issue, it healed, whatever they were worried about. But if we are going to try and fix something, we're going to wait till 9 months. The sweet spot is that 9 to 12 month, because our revision policy gives you that 9 to 12 month mark to come back in and have little things like that fixed. If, and only if, you've come to your follow-up appointments. So, and it says that on here. We want to see you at a week, a month, 3 months. Then when you come, if you're like, oh, I don't like my incision at that 9-month appointment, then okay, that's cool. We'll fix it, because we've been monitoring it this whole time. But if you have your surgery and then we don't see you until a year later and you have an issue, it might have been something that we could have fixed. It might have been a garment issue. It might have been something we could have fixed it beforehand. We didn't give the opportunity. So the revision policy doesn't apply to you. Then you're just paying for revisions at that point. The revision policy says, come to those follow-ups, we'll fix it. You may have a little bit of a supply fee. You may pay for sutures. You may pay $150. You may pay $200. It depends on what it is. You're paying for the supplies. Dr. Kratschmer's not charging you. You're literally just paying for the supplies. But if we don't see you, then you're just, a year from now, you're paying for the time and all of it, because we didn't have the opportunity. It's not to be mean. It's just because we don't want to do a big, surgical thing later when this could have been taken care of with lipofoam 3 months ago. You follow me? So, this is also the time that we remind you that we have a 24-hour notice for appointment cancellations or rescheduling. So if you get there that morning and it's, the day of your consultation and you don't show up, then we do have fees and things for no-shows. So if you can't make it to your appointment, please just call us. It sends you a text. You can cancel on the text. Just give us some notice. Okay, so that was, again, the post-treatment care plan.